you, everyone, for joining us here today. It's UN General Assembly Week. It's not just traffic jams in New York. It is a moment that we like at the Gates Foundation to sort of take a moment and really look and reflect on where the world is in terms of progress against the very ambitious goals that the United Nations has set out in the form of the Sustainable Development Goals. And just as a reminder, the Sustainable Development Goals themselves were born out of the Millennium Development Goals, which were launched in 2000 at the United Nations by then Secretary General Kofi Annan. And that is also the year that the Gates Foundation was started. And it's our 25th anniversary this year. And we've used that moment to take a fair bit of time to look back and also try and look forward. At our goal as a foundation is to help ensure that every person anywhere in the world deserves the chance to a healthy and productive life. That's led us to focus in particular in areas of global health, but also areas like agricultural development, inclusive financial services, sanitation, and related areas. And in global health, as you'll hear at the reception and the event tonight, we like to remind people that this century has seen the greatest successes in human history in terms of improvements in global health, particularly in child mortality, where preventable child mortality has dropped from over 10 million cases a year in 2000, when the goals were launched, to fewer than 5 million cases a year now. That we've seen a halving of overall mortality from the world's big infectious diseases, HIV/AIDS, tuberculosis, and malaria. And those are all through interventions that governments and philanthropies like the Gates Foundation and private sector partners have made in pioneering treatments, in the provision of vaccinations, in terms of tools like antiretrovirals, bed nets for malaria, and through partnerships, particularly the Gavi Vaccine Alliance and the Global Fund to Fight AIDS, TB, and Malaria, both of which the Gates Foundation was part of helping found. And together, those two entities have saved roughly 90 million lives over the last 25 years, 70 million of those from the Global Fund. And our announcement today that is embargoed is going to be our commitment to the next Global Fund replenishment. So the Global Fund has to get replenished every 3 years. And it's a call around to primarily governmental funders, but also philanthropies in the private sector. And we will be committing $912 million tonight, which is keeping our commitment steady from the last replenishment, and is a huge sign of confidence and faith in the Global Fund as arguably the most successful public-private partnership and multilateral relation of the 21st century. We think it's driven down costs, it's improved reach, it's helped create and incentivize the governments with whom it co-finances to get results. Yet we're at a very challenging time. And so this is we have an ambitious replenishment target, but it's looking very challenging to meet it. In fact, on current trends, it seems possible that we will raise less money than we did 3 years ago, even though the needs remain very acute because of government cutbacks in many countries, including potentially the United States. The US has obviously historically been the largest funder of the Global Fund and also in the broader fight against HIV/AIDS, but also other countries from the UK to Germany. Others are considering what they're able to contribute. The UK is actually a co-sponsor of the replenishment with the government of South Africa right now, and I think this is a critical moment and a testing moment to see what the world will be able to do and whether it can step up and meet the challenge. More broadly, though, I think it's also we need to acknowledge that it's a very challenging time in terms of broader political and economic headwinds across the global north and south, and especially in sub-Saharan Africa and South Asia and Southeast Asia, which is where the foundation primarily works. We've seen challenges around debt issues, around inflation, around obviously the drops in broader investment flows, the challenging global trade environment right now, all of which has made it very challenging to focus on what we regard and what, as a reminder, every government in the world committed at the United Nations to focus on their commitment to their own citizens. Again, encapsulated in the Sustainable Development Goals with the core priorities that we focus on at the Gates Foundation around the reducing poverty, improving agricultural productivity and raising incomes, and the goals around global health and gender equality and women's empowerment. And so we're hoping to use our time in New York this week. As the Gates Foundation, we're meeting with a number of governmental officials, both Bill Gates, myself, others, but also using our Goalkeepers event to try and call attention to these. And as a reminder that not only are the resources important, but, and I'll close with this, we have a pipeline of innovation, of new tools that we at the Gates Foundation and others have been working on, which can absolutely continue to accelerate progress in the next 2 decades. It's why, as the foundation, we announced early this year that we would actually commit to winding down in 2 decades. We will close our doors in 2 years because we want to maximize the resources that we can spend on today's problems and today's challenges and scale up today's innovations. That's a commitment that Bill Gates made to give the bulk of his remaining fortune, the vast majority of it, to the Gates Foundation. And it's a commitment of $200 billion over the next 20 years. And that's because we believe those are resources that if we spend them now, we can see dramatic improvements in the human condition in the countries and communities where we work. That whether it's in the HIV space and government, where there are new prevention treatments, and we hope ultimately new treatments and potentially over time even a vaccine, whether it's in tuberculosis, where we are busy trialing. One of our largest investments is a trial going on in parts of Africa and Asia at the moment for what would be the world's first new tuberculosis vaccine in over a century, where we'll get the early readout next year, and we're spending over $500 million on that, but we're very excited about the potential. Whether it's in women's health innovations, where we recently made a $2.5 billion commitment looking in areas like preeclampsia, around menstrual health, around gestational diabetes, where we know these are historically underinvested areas, but there's huge potential for improvements which will reduce maternal and child mortality across the global north and global south. And so we're here to highlight those innovations, to try and excite and crowd in public and private sector and philanthropic partners, and to hopefully energize and excite people and realize that at a time where there is a lot of general gloom and despair because there are tragic things happening all over the world, conflicts from Sudan to Gaza to Ukraine, that there are actually opportunities and action being taken by people all around the world, by governments, by workers, by teachers, that are transforming the lives of people every day, and that it's more important than ever that the world and government focus on that and focus on what we can do together. Clearly, the issue of broader reform to the multilateral health architecture, of which UNAIDS is one part, World Health Organization is another, UNICEF, the Global Fund, Gavi. There are a number of entities, and there are lots of discussions about ways in which we can get more effective and efficient impact at a time there are significant budget cuts. The World Health Organization, for example, with the US withdrawing, is facing cuts of over 20%. It means that, for example, the Gates Foundation is now the world's largest funder of the World Health Organization, larger than any member state. And in that context, there is a legitimate discussion we made about where and how there might be efficiencies to increase impact. I think the proposal around UNAIDS is one that is not even yet an official proposal, my understanding, from the UN in a draft document. I think it's for member states and others to discuss what the right structural framework is. But from our purposes, what we want to make sure, and highlighting HIV in particular, is that we maximize the amount of resources that are focused on reducing the HIV burden. That's part of what led to the creation of the Global Fund in the first place and the original creation of UNAIDS. And we need to be able to monitor and track that. That's a lot of the work that UNAIDS does, is in the the monitoring and the advocacy and the broader tracking phase. And clearly, we need to focus and make sure that the world continues to have those critical services, because that's the only way we can make progress against HIV. But it is reflective, as I said, of a broader funding crisis and challenge in the global health community. And it's one of the reasons why, again, we as the Gates Foundation are doubling down and recommitting our own commitment to the fight against infectious diseases. And in fact, I should have stressed up front that the two areas that we are going to stay most focused on over the next 20 years are the reduction in preventable maternal and child mortality, and in the fight against infectious diseases, particularly the aim to eradicate, we hope, polio and potentially even malaria, and really bring HIV and TB under control to a level of incidence that is the same in high-income countries that is in low-income countries. And so we would urge all countries and member states who are looking at multilateral reform to make sure that they keep the goals in mind and make sure that we are funding what is needed to address the needs of the patients. Clearly, from where we sit, we feel strongly there is no real justification for cutting funding to global health. Of all the areas that the world invests in, it's one of the clearest connections between the resources we put in have a very high and measurable impact. Yes, in any sets of organizations or interventions, there is always room to look for efficiencies. And I think it's important that we do that in the health sector, and the discussions around ways in which you can potentially streamline supply chains for procurement across maternal and child health commodities, as well as HIV or TB or other. Those are important areas. We're constantly looking for ways to become more efficient. And indeed, the global health sector has become steadily more efficient and higher impact using more limited resources over the last 25 years. So our core message is exactly that to every government we talk to, whether it's an African or Asian government prioritizing their own national budget. We say there is no more effective investment than the human capital of your own citizens and the health and nutrition to build and grow a new generation. And to global funders, similarly, if you want, there's both an interconnectedness of global health, which the world has learned the hard way, but also this is more broadly, both morally and practically, these are the most successful investments the world has made, and we want to continue, and that's why we're putting our money where our mouth is and making those investments. I think the responses we get are unsatisfactory, let me put it that way. I think it's fair that there are debates within countries about what resources they should commit to the needs of their own citizens versus global commitments. But as a reminder, the Sustainable Development Goals and these broader global health objectives were signed on to by every member state, including the US. And so whether it's the UK, whether it's Germany, whether it's France, or whether it's the US, we are in active dialogue with all of those governments, trying to get them to minimize the cuts. And in the case of the United States, yes, clearly there have been significant cuts. The closure of USAID is, at this stage, an established fact. And the USAID did do some enormously positive work over its lifetime, and we think it is the US has played a critical global leadership role in global health. It's been by far the largest funder of global health over the last 25 years. And so, yes, Bill is directly making the case to President Trump that we are talking to the administration. And I think we have some critical test cases coming up. It is not yet clear what the US contribution to the Global Fund replenishment will be. We will know that within the next couple of months. Historically, it is the largest funder. It normally funds historically a third of global health. So we are waiting and making the case and hoping that case will be fall on receptive ears, but the proof will be in the execution and the funding. The broad issue of how we're funding and supporting the innovations is, and you've had, and we'll hear some examples tonight as well, whether it's in nutrition, whether it's in, actually beyond health, we work in agricultural development, whether it's some of the maternal child health interventions I talked about. In all of those, we're constantly working in partnership with both regional entities like the World Health Organization, AFRO, the African region there, or the Asian equivalent, and directly with national governments. In the end, it's national governments that make the core, right? And it's one of the reasons why we've expanded our regional presence, especially on the continent of Africa, more broadly over the last decade. So we work, whether it's with Nigeria or in Ethiopia or in India or Sri Lanka, we will be actually working directly and responding to national government priorities. And that's the most critical thing, because that's where the real capacity lies. The strength that a philanthropy has is being able to take some of the risky innovations in the new tools. So for example, in the case of malaria, as artemisinin, as resistance to bed nets was developing, the first generation of bed nets from mosquitoes, we were able to put in the investments and develop this now second generation of long-lasting insecticide-treated nets, where that innovation is funded by the Gates Foundation to prove the concept. But then the manufacturing of that includes manufacturers on the continent of Africa. The distribution and purchase of it is through entities like the Global Fund, working with co-financing from the national governments. And that's how you make it sustainable. Clearly, we're very aware that as a philanthropy, it's not our role to be responsible for long-term delivery at scale of any of these interventions. The primary responsibility has to be from the national governments themselves, prioritizing that. And then working with international intermediaries like the Global Fund or Gavi, which are able to, the strength of those entities is they're able to pool the money and make contracts that drive down the costs very significantly. So, for example, the cost of antiretrovirals for HIV has more than halved. The cost of many of the key vaccines has more than halved, because by being able to purchase at scale, you're able to negotiate contracts with the manufacturers and increase the level of distribution. So as we think about our role, as I say, part of what we're hoping is that many of the problems we work on will have gone away by the time we go away. Like, we hope there will be no more need for polio vaccination campaigns anywhere in the world, because polio will be eradicated. And so that's one set of things. And for the other areas where we hope there will be strong, robust national vaccination campaigns that are fully funded and run by the governments themselves. In the case of Gavi, there have already been around 19 countries have graduated from Gavi commitments with their income, and they self-fund. And certainly the expectation is for partnerships like that is not that they exist in perpetuity, but that over time these are taken over by national authorities, and we'll be working to see what we can do to help ensure that happens. The long-term capacity of partners to be able to implement on the ground and be sustainable after we're gone. So in the end, sustainability has to be done by the governments and the communities where the work takes place. There's no substitute for that, and that's why we talk about the necessity of governmental ownership and leadership. Our role is catalytic. I mean, that's the real advantage of philanthropic resources, is we can prove, we can test the innovations, we can prove different models of delivery and the way in which work can be delivered. Again, that's not exclusively in health. In areas like agriculture, we've got innovations in whether it's poultry, whether it's livestock, whether it's dairy. These are sort of important areas where you can test, use innovation again to create improved productivity for smallholder farmers. And the rural poor are 75% of the world's very poorest people are rural poor, who depend on small-scale farmers for their livelihoods. And so in each of those areas, We produce the innovation, we'll test different models of delivery, and then we'll work, whether it's through third-party entities, whether it's sometimes enabling the private sector. Our work in financial inclusion, inclusive financial services, for example, is the regulatory framework is put in place by governments, but most of the provision is done by the private sector. But in all of those, we're constantly thinking about what is the route to long-term sustainability without our resources, because that has to be what the vision of success. Another level, relative to the trillions of dollars economic damage or whatever feels very reasonable. And yet here we are 5 years on, and the sum total of investments that have gone into the pandemic trust fund at the World Bank is less than $2 billion, not $10 billion a year, a cumulative total of less than $2 billion. And so if there's one headline message we have for all of our things, is that the world underinvests in health. It's not just the World Health Organization, it's all of those other entities. And instead of increasing its investments, currently we're seeing continued cuts. And that's, one of our core messages this week is to try and prevent that from happening and saying those are very short-sighted cuts. The governments should not be making them. So we do have strong data and measurement things where you're having access to vaccination, access to, whether it's bed nets, antiretrovirals, access to the agricultural things. It's important to acknowledge, as we have in previous years, that the last 5 years has seen a dip. The COVID period led to a significant, reduction in, for example, global vaccination rates, big setbacks in education. If those of you who've been here for previous goalkeepers, we talked and tracked some of those setbacks, which have taken a while to rebuild. So we're just now, 5 years later, almost getting back to where we were in 2019. Global vaccination rates are just about back to where they were in 2019. We've just got some of the global poverty rates back to 2019, 2020. And so that's a challenging at one level. If the world had continued at the trajectory it was going between 2010 and 2020, we'd have made significantly further progress. We wouldn't be sitting at the UN saying we're at significant risk of missing the vast majority of sustainable development goals, which we currently are. That said, for some of the most critical areas like preventable child mortality, where the official SDG target is 25 per 1,000, to try and getting a little technical here, but that's where we wanted the global target. At the global level, we're not too far off. We're close to at around 31 per 1,000 at the moment. That could still be reachable by 2030, but that hides significant variabilities. In conflict-affected areas, particularly in Africa or large parts of the Sahel, you'll see much worse outcomes than you might in other parts. And so it's very important to be nuanced, if you like, by where you're looking at the interventions of success. And one of the challenges that we have as a foundation is because we are a foundation, we're a philanthropy, we're not a governmental actor. We really can only work successfully when we are able to work in a country where there is a willing governmental partner aligned with us and willing to take steps and investments. We're not in the business of being able to sort of operate in conflict zones, but we know that a lot of the setbacks that are happening globally are in these conflict areas, whether it's an area like Sudan right now. And so that is a sort of challenge when we look at the global metrics, and it's why at that level the glass is very much half full or half empty. But at the other level, and the reason why we stress the pipeline of innovations and the progress that has been possible, is we feel what we've been able to prove, not just over the last 5 years, but really over the past decade plus, that there are a set of very cost-effective interventions which can be put in place in real time right now that will have a transformative impact on basic health outcomes. And then a next generation of innovations like the tuberculosis vaccine I'm talking about, or ultimately some of the new interventions in women's health that we think will massively accelerate that progress. So there's not a neat, correct answer, but the key is really measurement and then acknowledging when there are setbacks, which we certainly, the last 5 years have been a very challenging 5 years, and we're in a very challenging moment right now because of the fiscal challenges, but then saying here is a plausible, measurable pathway that why we believe over the next 5 years we can actually bend that curve, the graph, to just to accelerate progress again. Not to be across the board, we'll speak with everyone and anyone to make the case for these investments. So I want to be clear with as the US, with any head of state we talk to, whether it's a head of state of an African or an Asian country, we are talking about the need for them to increase their own investments. I mean, remember that the vast bulk of African countries have never met their AU commitment of the percentage of their budget they're supposed to be investing in health or agriculture. And we do that with all of the governmental partners, whether they're European partners or the US, because we're making the case. Again, we believe there's a moral case, but the case we're making is one on proven facts. We can show how those investments have had a transformative impact, have been efficient. These are not, there are often accusations, are these being misspent or misallocated, and we can actually track and say, no, we can show you exactly where that investment in a vaccine or an antiretroviral or a bed net is going, how it's reaching the person who needs to meet that. And so, yes, you'll see tonight's event actually has a number of other philanthropic partners, and we've also, I've made in some of my previous annual letters, multiple calls of the one cohort of people who have got significantly wealthier over the last 5 years are the world's billionaires. I work for a billionaire who is committed to give away over 99% of his fortune to these issues of global health and development. We are also supported by two other billionaires, our former co-chair Melinda French Gates and Warren Buffett, who have also committed to give away the vast majority of their fortune. We believe many others should ideally follow that same pathway. We think both within the countries where we work, whether it's, again, in South Asia or Sub-Saharan Africa, we actually engage directly with philanthropists there, and here in the US, making the case that there's an important role. But I do want to be very clear, philanthropy can never substitute for government. And I sometimes worry that making a call for philanthropists can sometimes be an excuse for some of those, particularly traditional donor governments, to make cuts. We say, well, we don't need to make those investments because philanthropy can cover it. And we go, no, we can't do it at that scale. Remember, back in the US, our budget next year will be a record $9 billion US. That's the largest payout ever by a philanthropic foundation, or will be. But USAID's budget was $40 billion a year last year, and total US aid funding was closer to $70 billion. We can't make up those kinds of shortfalls. I didn't fully answer the question there about how you build trust, and I think this is critically important. So first on Indonesia, the Indonesian government has been a great partner. Minister Budi is a strong leader in global health. Indonesia is a good example of a country that has significantly increased its own investments in global health. It's one that recently graduated from Gavi, and actually at the last Gavi replenishment a couple of months ago made a direct contribution. It's an example of a middle-income country then contributing back to an entity that it had benefited from historically. And Indonesia is part of the phase 3 trials for this tuberculosis vaccine called M72, because it does have the second largest TB disease burden after India. And it's a tragic fact of the modern world that there is a lot of mis and disinformation, particularly around global health issues, everywhere, that it got exacerbated during the COVID crisis. And I think it's become a very important issue that is one of the biggest risk factors to global health going forward. I think it's then critically important for entities like the Gates Foundation that support this work, but also for government to be first fully transparent. That what feeds conspiracy theories is if there's a sense of something being hidden. And in our case, there really isn't anything being hidden. That the sites, the mechanism in this case of the trial, where the trials are, what their timelines are, what the results are, we're going to be fully transparent. There's a significant risk they might fail. That's, I say we're putting well over $500 million into something which it's going to be binary. They'll either work or they won't work. But I think that's very important. Having the legitimate health authorities like the ministry speak out, and this is, again, true. It's as true in the United States now as it is in large parts of the world. Professional groups of professional, of medical professionals, associations of pediatric doctors, others, those voices are more critical than ever, that you need to be able to come in and show and reassure people that there is nothing being hidden or misleading. And then last but not least, and we've seen the importance of this, for example, in the fight against polio in Nigeria and other areas, is getting community leaders, particularly faith-based leaders, being able to validate as well, because you need the scientific support, but you also need the community leadership to be able to encourage mothers that are concerned about safety for their children. But it's definitely an ongoing challenge right now that if you all have ideas for us, I think the media has a very important role in combating misinformation and disinformation in health, and it is definitely more difficult in a world of social media, but for us the most important thing is first and foremost being completely transparent about what we're doing and why we're doing it. Well, I'd say the first one is just being fully transparent about what we do and why we do it. It's why I think it was critically important when Bill made his announcement in May about committing the bulk of his fortune. Our hope and part of the intent was it removed some of the suspicion, because there have always been confusion and allegations. Why would such a wealthy person be giving away his fortune? He must be somehow enriching himself. He must have investments in these pharmaceutical companies. And so, one, we don't. So to take those examples, the Gates Foundation Asset Trust has a policy it does not invest in any of the major pharmaceutical companies. Second, with this commitment, everything that gets generated will be returned to the foundation. So there isn't that won't stop the conspiracy theory or some of the conspiracy theories, but we'll do that. But the most important thing is less, we'll correct facts where we can, but back to the questions we started, where in the end, the lead around these issues has to be national governments and the communities themselves. And so in our case, what we're constantly doing is how do we help groups like you understand what we're doing? How do we get partners in the communities who are validators, who see the work, are able to speak a bit? Because I think the best defense is actually third parties rather than us speaking ourselves. We'll certainly be open whenever people might have questions or comments, and as I say, we'll be very transparent about any of our investments. But that is what we're trying to do. It is, again, challenging in a world of social media where you get closed network loops of WhatsApp messages and others, and how you provide accurate information into that. That's not a problem that we alone are dealing with, and certainly, speaking on behalf of Andy and Buchle and others, we would welcome advice you have to us on how we can combat that as possible, because it's an ongoing challenge. The first is the discussion and debate needs to be led by African regulators and African scientists. And so we do provide support to networks across Africa around that, and globally. But in this case, you're talking about Africa, where there is that debate. Because for anything we do, we absolutely believe we need to follow the science. That's what you first need to do. Safety and human safety is paramount in anything and everything we do. Now, the science around that is fairly strong and robust, but it does need to be done almost country by country. The regulators need to look at it because, especially in the area of agriculture, you get slightly differential outcomes in different agroecological conditions. So that's the first and most important thing. The second is, yes, absolutely, you want to make sure there are pipelines, in this case it's for seeds, but whether it's livestock or others, that are helping build strong, robust partners on the continent. So, our biggest delivery-related partner in agriculture is AGRA on the continent, and that helps work around seed distribution and related issues. But I want to be clear that our work is on the full range of ways you improve productivity across seeds and livestock. That even the way they're framing, yes, there have been some investments that look at potential GM investments. The majority of them these days are traditional conventional breeding that we do with the National Agricultural Centers, the NARS, and with entities like the Consultative Group for International Agriculture, CGIAR, which is the main global framework, and that works with the national regulators. And the long term, again, needs to be governmental. To take a Nigeria example, or actually an example of this maize called tela maize, which is a sort of drought-resistant form of maize, which is now being extensively used in Kenya. It's just doing some trials in Nigeria. Those are ones that's been through a decade plus of intense regulatory scrutiny, at the continental level, at the national level, and it needs to be done crop by crop. And in terms of the dialogue with farmers, yes, ultimately the farmers need to have the information themselves, get the support and training from their own governments, the agricultural the regulators, and then make their own choices. But our goal in everything we do in our agricultural work is how you're actually improving the income and productivity of the smallholder farmers themselves. That's the metric of success. It's not about any intermediary. It's what helps them improve, increase their income and be able to provide for their families. So there's no dependency being created from our investments of the smallholder farmers. My aspiration is that we at least halve child mortality again by 2040. And I feel cautiously confident we will get there. But the truth is it is much harder to halve again. The successes that we've had reducing from 10 million to 5 million, by far the largest single contributor to that has been the provision of basic childhood vaccines. And now around 80% of the world get vaccinated. So yes, we still need to make sure that the 20% who don't get vaccinated, but there won't be as many improvements there. Currently, 50% of the remaining, it's under 5, it's about 4.6 million deaths, are actually die in the first month of life. And about half of those die in the first 24 hours. And so those are interventions that are about complications during pregnancy. It's about your respiratory problems. It's about postpartum hemorrhage. It's about these interventions are actually more difficult. A vaccine is a vaccine. These require trained medical personnel. They require other interventions. We've highlighted in previous goalkeepers some of those ways in which you can reduce postpartum hemorrhage or improve anemia. Some of the world women's health innovation research we do is around anemic women give birth to low birth weight children who are much more likely to die in the first week of life. And so it just requires slightly more sets of interventions. I'm very confident we can make those interventions. We know what they look like, but that's why it's a little bit more challenging to halve it again. Women's health is dramatically underdeveloped. I mean, preeclampsia and gestational diabetes, to take those two, affect women all across the United States today. It's not a problem of the global south, even if the burden is higher. And yet there is almost no significant research and development investment in those and in some of the other key areas around menstrual health and related issues. And so that's why we were surprised ourselves when we were doing the mathematics and looking at where the research is, making our big commitment around women's health innovations, how significantly underinvested that remains. And I think that's, again, an indictment of how global research allocations have happened over the last couple of decades relative to disease burdens, but it is unfortunately the case. There's no easy pathway, and the difference is, for lower middle-income countries compared to low-income countries, it's a much steeper path for low-income countries. Net resources going to low-income countries have actually been stagnated and have dropped relative even to low middle-income countries and middle-income countries. So countries that have gone the pathway, like Indonesia, to do significant amounts of self-funding, that takes 20 to 30 years of economic growth and investment, and it does require then investing the scarce resources that you have back in your people and doing the domestic resource mobilization. Even the very poorest countries are able to increase significantly what they do raise as domestic tax revenue and invest that in. But I'm saying it is not a quick pathway. I do hope with a 20-year pathway, which is our horizon, I think a huge amount can be done. I do think one of the very few silver linings of the current pullback in global health financing is it has actually focused the attention of finance ministries and heads of state on health funding, where often health is a little bit orphaned in national discussions, but now the prioritization that is seen is more important. But it won't stop us making the case for why you do need to keep on investing in global health, and we don't think that it's the area that should be cut. There's a huge amount of dynamic work going on around AI, not just in health, but in agriculture and education. And we are investing across all three of those sectors because AI is another one of those areas that, left to the market, they will prioritize interventions for high-income both countries and populations within countries. And so I think there are a couple of areas. One, we demonstrated last year. Bill was wandering around with this handheld device that can do ultrasound, that you attach it to a cell phone in a low resource setting. And what it does is there's an AI algorithm which takes your low to medium resolution image and can actually give you a diagnosis of the at-risk, whether it's an at-risk pregnancy, that at an accuracy level that is comparable to a fully equipped ultrasound room in a fully equipped hospital. And that technology actually has potential, at the moment it's potential, but we're optimistic, for things like TB diagnostics. Kind of do the same thing around lungs. At the moment we don't have a very good TB diagnostic. Can it ultimately be used for a number of other diagnostic interventions? I think there's huge potential there. Obviously, our primary focus is around the maternal child healthcare one. A second is just on the actual treatment triage. So AI assistance to community-based healthcare workers. I actually think there's significant potential to improve both the support of community healthcare worker advice, but also self-care. So something like the HIV challenge, where we're having some of the pullbacks, we are doing investments. Can it be if you're a patient in Southern Africa with antiretrovirals, where you've been dependent on a lot of support directly from healthcare workers, there are potential routes where you can use AI as a sort of enabling support that should, on both your prevention advice, linking into your medical provider to make sure you're getting the provision of the antiretrovirals or other tools you need. Again, we're developing. These are, I don't want to oversell them yet. Like all things in AI, there's prone to a lot of hype. But some of the early signs are very promising, and we will be investing quite a lot in pilots in those areas.